Hey everyone, Dr. Cranky here, and today I have my lovely giant breed participant, Cal. So he is here today to help me talk to you guys about something that is very common in his breed and is something that can ultimately be fatal in these giant and even large breed dogs. Today we're going to be talking about GDV, also known as Gastric Dilatation-Volvulus, and something we can do to prevent it, which is known as a Gastropexy. So gastric dilatation-volvulus, or GDV, is something that can get confused with bloat. So they are two separate things, and bloat generally is not going to be as severe as a GDV, simply because we don't have some of the more severe things go along with it, such as blood loss to the actual stomach itself, which is ultimately one of the things that can be the deadliest in these guys. So bloat is something that the stomach itself actually gets bigger and expands. Normally that's due to something along the lines of it being full of gas or food. And so that's usually a problem that can be fixed without surgery, but sometimes can require surgery as well. What is so different with GDV is that, yes, the stomach does bloat, but it actually flips on itself. And that's that volvulus portion of the GDV. And that is something that can ultimately be very detrimental to your dogs, especially if it's not caught early and corrected very quickly by a trained veterinarian. It is something that, like I said, these guys are going to be a little more prone to. So various breeds are a little higher risk. Great Danes are ones that are about 10 times at a greater risk for GDV compared to other dog breeds. And about 40% of Great Danes will suffer from a GDV at some point during their life. Same thing kind of goes for that possibility being a little higher for some larger breeds such as German Shepherds, Standard Poodles, Rottweilers. Any of these dogs that have a really deep chest are what we're going to see have the biggest possibility of having this issue arise. Things that kind of predispose them to it, other than their size, is if they are playing a lot after they eat and bouncing around. That can kind of provoke the stomach to flip over. If they are sucking in a lot of air. So we, as veterinarians, will really want to talk to you about these giant breeds, about things you can do to try to prevent the stomach from actually doing that. And so things you can look for at home are going to be, if they actually have this come around, is that they are going to be retching, so they're trying to vomit or gag something up, but it's not coming up. If they are really lethargic, laying around, or even if they're pacing and just very restless. We can also even have some of these guys that have a really firm abdomen, or you see it actually being bigger and very uncomfortable for them. And so that is certainly something that is definitely worth a call to the ER and could even be worth a trip if they determine that's what's going on with your dog. More along those lines, as it is something that's time is of the essence, and so you really want to make sure that you're getting your dog taken care of very quickly. So what can we do to prevent this that could be an overall fatal type of issue that goes on? So one thing we can do that we try to do is obviously the at-home kind of things we've already discussed, but mainly what is called a prophylactic gastropexy. So with prophylactic gastropexies, that is actually where we go in surgically and we will tack the stomach, part of the stomach, to the right side of the body wall and allow for that stomach to actually fuse with that body wall so that our hopes are it will not flip. Can it still bloat and get big? Yes. But that is something, like I said, that's not typically a fatal issue. But once that flip has occurred, that's when we really have problems starting. And so to be able to tack that to that body wall, we're trying to prevent that volvulus from actually occurring. Cal here had his gastropexy done at just a few months old, so we could hopefully try to prevent that from happening to him. We'll see if he'll show us his scar here. So it's just a scar right along through here. So it is something that they have about a week or so recovery time. Same thing if they were spayed or neutered, and a lot of times that surgery can be done at the same exact time, so they're not under for multiple occasions. And we have learned that gastropexies are something that are about 90% effective at least, and that is in the hands of a skilled veterinarian that is familiar with the surgery and can get that done. And there's not every veterinarian is going to be able to do that, so you definitely need to speak with your veterinarian on if they're comfortable doing that and dealing with these issues that the giant breeds can have. And like I said, recovery is usually not a huge ordeal. We have them eating a little bit less as far as overall at meal times, having those spaced a little more throughout the day, keeping them rested, keeping them calm, on pain medications, and then they're back up like it never even happened. But that can ultimately be something that you can do to help prevent your dog from having a very bad issue that can turn into a fatal consequence not very far down the line. So if you have any questions or anything, certainly reach out to your veterinarian. Feel free to leave a comment or anything below on any issues that you have had with your own dogs or experiences you've had with GDV or Gastropexy. I'd be happy to answer questions if I can. Don't forget to like, share, and subscribe to our page. We want to keep on producing these videos to help you and your pets.